Thank you for joining us. There's an essential connection between health in general and education. I'm Richard Peritz, and to tell us about this, we have Dr. Fischler, President Emeritus of Nova University, and Kimmi Lee, a clinical pharmacist at Life Extension and a graduate of Nova University herself. They will share their thoughts on these subjects from their own perspectives following these messages.
I read Life Extension magazine to keep abreast of medical discoveries that can literally save my life. Life Extension's track record dating back to 1980 shows that they are decades ahead of conventional medicine in identifying proven methods to prevent and treat the diseases of aging. Reading Life Extension magazine will empower you to take control over your health and longevity. And as a special favor to me, the Life Extension Foundation will give a free 1-year subscription to anyone today. Just call the number on this screen to obtain your free Life Extension subscription. There's no cost, no obligation, just the opportunity to discover solid options to live longer and better. Call the number on the screen today to start receiving Life Extension magazine each month.
Take charge of your health. Get your free subscription to Life Extension magazine now by calling toll-free 1-800-509-9117 or visit www.lef.org.
The Technion opened the Faculty of Medicine in 1969 because in the future, medicine and technology will walk hand in hand.
One of the unique qualities of working in Israel and learning in Israel is that you really get to see the Middle East for what it is. Here at the Technion and here at Rambam, we take care of Arab patients, Jewish patients, we take care of patients who come from Gaza and the West Bank and Jenin.
Well, I'm working as a physician in Emeritus Hospital in Afula, and we have groups of students coming from the faculty. I'm sitting with them, I'm speaking with them, I'm reviewing with them the cases.
When a student comes here, they will get the most focused attention on their growth and development as a future clinician. The issues that we talk about in the classroom and on the ward range all the way from specific clinical details to how to help patients live better, fuller lives.
Technion researchers in the Faculty of Medicine are involved in developing new medical technologies for the benefit of mankind wherever they are.
The Technion gives you immediate access to a wide range of scientific experts, and these same experts are the ones that are in the classroom teaching you.
I'm from Chicago.
New Jersey.
From Montreal.
I knew I would receive a great education here.
The TEAMS program offers us the ability to become American-trained physicians studying in Israel with some of the best doctors in the country.
The Technion is all about innovation. We are looking for students that are interested in combining research and medicine to be the next innovators in the next 10 to 20 years.
I chose the Technion because of their strong emphasis on research.
So the really unique thing about the Technion Medical School is that we also have a technical university which gives rise to a lot of medical technology, and it's interesting if you want to do your research for those possibilities.
When you study medicine at the Technion, you're really in the top league.
At Johns Hopkins, everybody had heard of the Technion. Many Technion physicians have come here to do either a fellowship or an internship or some kind of rotation, and then went back to the Technion. So at Johns Hopkins, I had no problems at all to say proudly that I came from the Technion, and I think that was a feather in my cap.
In retrospect, the Technion program was outstanding in its preparation. Taking the U.S. MLEs, the American boards, I felt that we were overly prepared in terms of the level of our medical background and understanding.
We are very proud of the graduates of our medical school who are pioneering medicine not only in Israel but in other countries all over the world.
Hi, I'm Kimmi Lee, pharmacist with Life Extension Foundation, and I'm here with Dr. Abraham Fischler just to ask a few questions about education. Hi.
Hi. But stick to education and not pharmacy. How's that?
Let's stick to education, of course. I graduated from Nova.
I know that.
And it was such a wonderful experience. And one of the biggest things is the education that I got from Nova. It was very unique. And one of the things that it taught us is, you know, when we go out into the real world, you know, sometimes there's more than what we're taught in school. And I know, as you had mentioned a lot earlier, that education is the key to the future of the minds. And, you know, I just wanted to know from a perspective, you know, do you think that there could be more that we could be doing in the education system to prepare, you know, the graduates for the real world? Because it's very, very different.
There's a need for an organic change in the way in which we educate our children from birth through age 22. The way we're set up now, children in preschool have an opportunity to learn by doing. And they play with Dean's blocks and all types of activities, and they learn symmetry in that way, and shapes and sizes and things of that nature. But the tendency, as we move up further in the educational system, they become passive learners because teachers want to teach, and students have to learn what they're taught, in many cases through symbols like reading and lecturing, listening, and we have to make sure that that doesn't continue. We have to transform the way we teach so that the environment provides tools through which children can learn. And instead of worrying about the printed word as much as we do, yes, they have to learn to read, but they have to learn that in reading you have to have a certain level of skill, which is analysis and synthesis and self-judgment. We don't spend enough time doing that as much as comprehension, which is the simplest level which we get. They spend a good deal of their time sitting instead of actively learning. So the pictures I just left with Mr. Peritz shows the transformation in the university school of children actively involved in learning by being in small groups, manipulating objects and seeing what happens as you change shapes, and learning geometry by actually doing geometry through the problems that they have to work on. So that has to change. So the teacher becomes a guide in a learning environment, and by manipulating the environment and providing opportunity for students to really teach one another.
Okay. So I completely agree. And, you know, with the mention of manipulating the environment, how does our environment affect the ability of our students to learn? Do you think there's a connection between nutrition, exercise, healthcare as it relates to education?
You're absolutely right. But we don't have to formally learn that in a school environment. If you want an athletic program, students can go out in the yard and work out for a half hour with some supervision. And that's exercising. Right. Okay? You can give them puzzles to work on, which exercises the mind, and especially if you have a variety of. That's what geometry does. You can teach geometry through manipulating space and looking at the congruence of space. And the design is all doing that. My wife picks up the newspapers about 10 o'clock in the morning, and she doesn't give it up until 12 because she does all the puzzles, a whole variety of puzzles which come every day.
You're exercising your brain.
And you're exercising your brain. So all those things can be done in an environment which enables students to have the time to achieve rather than achieve at the rate I think they should be learning. So in the model that I have in my head, and which we now are beginning to implement, is that education is a continuum, and it may take you a little longer, or you may be very bright and get there quicker, but we have to provide an environment which is flexible so that the student succeeds. I'll tell you a story, a true story. I took up golf when I retired for 6 months. Okay. I was 65. And one afternoon I was playing with my friends, and I said, think how stupid I am spending 4 hours trying to hit a white ball in a hole. And I wasn't even getting exercise. Okay. If I used 4 hours exercising, I would be developing upper body strength and all of these things. Golf doesn't do that for you. It just buys you some freedom. Mm-hmm. But what are you doing with your freedom? You're hitting a white ball in a hole.
Right.
So I stopped.
Okay.
I stopped playing golf that way.
You did?
Yes.
Okay. I work at Life Extension Foundation, which is the largest organization dedicated to investigating every method of extending the healthy human lifespan. If I may ask, what is your secret to staying healthy and so very active?
Staying busy, being productive, have a reason for putting on my pants every morning and getting out of the house so I can do that. The worst thing you can do is retire and not have the two. And so what do I do today? What am I going to do? Where am I going to go? How am I going to fill up the day? That's not good. Okay. You really have to have a set of objectives that you're trying to achieve, whether it's in golf, if you're serious, you go out and you do what you have to do, or some other, but you have to have an objective, a reason for getting up, a reason for getting out of the house, a reason for exercising your mind and your body.
Richard told me that you're very conscious about what you eat and how you take care of yourself.
Yeah, because when I was a young man, I went into the service in World War II, and when I came out, I was much heavier than when I went in.
Really?
Yes, much heavier. I gained weight because I was a medic.
Okay.
I was in the operating room as a corpsman and enjoyed it, learned a lot,
right.
But I also ate a lot.
Okay.
And didn't exercise like I was doing before then. So I decided that I would have to go back and balance my time and leave room to exercise my body as well as I was exercising my mind.
How do you feel about the importance of students understanding the effects of nutrition and how it relates to their education?
It depends on how they learn it.
So do you feel that we should be promoting nutrition, the right foods that will help feed their brains?
I think you should be promoting it through a set of opportunities for students to try new foods, to be selective on the basis of the knowledge of what foods and how to go about selecting food that's both nutritious and tasty.
Of course, that's important.
And you can have the same thing, but you can have 3 ounces instead of 6.
So no French fries.
And no French fries.
No French fries.
You get sweet potato fries.
There you go. That's great.
So what I did was I wanted to bring my weight down again. As you can see, I weigh 168 this morning, and I'm conscious of what I weigh. And when I move up above 170, I ration myself for a couple of days so I can lose the 2 pounds that I put on. So I try to stay between 165 and 170.
That's great. So you're very conscious.
I'm very conscious of the weight problem. And because of the early deaths of my family, I decided I'd live longer, and I've been very successful. Because as you can see at 85, I'm still active every day.
Very active. So you exercise, you eat right, you move daily. I think that's the key.
That is the key.
That is
and have a place to work in a productive way.
This has been so interesting. Thank you so much.
Well, it's good meeting you, and keep
Very
up
nice
the good
meeting
work
you. Thank
and
you.
the cause.
Yes.
With us now is Professor Shlomo Yosef, the Director General of the Hadassah Hospital in Jerusalem. Sir, it's a real pleasure and privilege to have you on the Shalom Show.
To me as well.
Tell us, sir, what are the challenges facing medicine and your hospital in general in Israel at this time in history?
You know, Hadassah started 100 years ago, and they decided to build a healthcare system in Israel. So every generation there is a different challenge to Hadassah and to medicine all over the world. So for us in the hospital, the challenge is really to bring the best healthcare service to the citizens of Israel, which is a cutting edge of technology and a cutting edge of knowledge. This is on the clinical side, but we also are very much involved in education. We have medical school, we have school of nursing, dental school, school of public health, and occupational therapy. And just recently, we introduced a military track in our School of Medicine as the government asked us to do it as part of our mission as a Zionist organization. And the third part is research. Today, there are so many innovations all over the world, and especially in Israel. And we try to put it in a structure of research done by physicians and in order to find solutions to diseases. Not just to increase the knowledge in the world, but really to find solution to specific diseases. So this is what we do right now when we are one of the world leaders in embryonic stem cell research. And we chose to treat the brain, Parkinson, MS, Alzheimer. The eye is part of the brain, and macular degeneration is the main cause of blindness in the world. And we decided to concentrate on this. And 2 years from now, we hope to start the first clinical trial in the world in which we use embryonic stem cell in order to treat patients with blindness. So this is just few examples. And really the main challenge is to go to what is called personalized medicine, in which you adapt the treatment not to a disease, not to breast cancer or prostate cancer or brain tumor, but to do it to a specific patient, to patient A with breast cancer, who is obviously different from patient B with breast cancer. So today, with the knowledge about genetic of the patient, of the individual, genetic of the family, genetic of the tumor, and when you put all this together, you can differentiate it between patient A and patient B. So what does it mean? It means that we can tailor the treatment to a specific patient. And sometimes to say to a patient, you don't need this treatment, it only causes you side effects and not real effect. So this is, as I see, the challenge on the global medical activity. Our own challenge is to build the campus in Jerusalem in a way that it will adapt the campus to the future need of medical services. We are building today a 1 million square feet building, the Sarah Wetzman Davidson Tower. And we decided to put the operating room underground, 5 floors below ground level. So in any type of war, conventional, biological, chemical, we'll be there. We'll be ready in full operation.
What a tragedy that such measures are necessary in this day and age. You would think that with technology and education so clearly available worldwide that rational people would implement intelligent solutions to the problems in the Middle East and of course everywhere else.
You know, I'm not a politician, and what you said, it's what everybody feels. But at the end of the day, emotions control rational. And what we experience today in the Middle East and Israel, we don't feel that we are near to a solution. So we at the hospital have to take our measures. We have to be prepared. We have to train our doctors and nurses. We have to do drill after drill after drill in order to be ready at the time when it will be needed.
Why is the Hadassah Hospital, if I may ask you this question, so world famous? Why is it? What's unique about your hospital?
What is unique about the hospital is, first of all, we were the first. We really introduced academic medicine to Israel, and we are still the first. Every year we introduce different type of new procedures. Just last month we introduced the first cyclotron into a hospital, in which it's a small nuclear generator that helps to provide nuclear material for diagnostic of specific diseases. We were the first to introduce aortic valve replacement via catheterization, and more and more and more. So this is one thing. The other thing is we are fighting for coexistence within the hospital setup, in which we are a humanitarian organization. And every patient, the minute he crosses the door, we don't ask what you did, where you come from, and what is your political view. We treat patients, terrorists, Arab, Jews, Turkish terrorists from the flotilla, all those were treated by us as part of our concept, belief, and spirit.
Would a hospital in an Arab country do the same?
I mean, I'm not the person to be asked. We never experience it. I mean, doctors are doctors, but hospitals sometimes got some sort of instructions from authorities, and it's built upon, many, many years of beliefs and culture, and the Jewish culture, and the Hadassah spirit, and the hospital education along so many years brought us to this point in which we feel that we would like to treat whoever in needs, in Israel and outside Israel. I'm sure you heard about the mission of the Israeli doctors and nurses to Haiti.
Absolutely,
this is one example. And we have missions to Ethiopia.
They were actually the first hospital
Africa.
that actually arrived in Haiti, correct?
Absolutely, because in Israel, the doctors called me and said, Shlomo, tomorrow we are leaving to Haiti. It's first priority. And we took care of his patient and his responsibility in the hospital, because he volunteered to go abroad in the name of Israel, in the Israeli military and the Hadassah Hospital. And this is first priority. This is why we were there first. And in the first 2 weeks, we were the only game in town.
In the course of your career, have you experienced that the Arab neighbors are realizing more and more that how the achievements of the State of Israel progress and move forward, and where they are staying perhaps in a kind of same situation? Are they becoming more educated and realizing that more could be achieved in mutual cooperation and peace by looking at the model of the achievements of the State of Israel?
I must tell you that they look to Israel and they come to Israel and they experience the ability that we have in Israel in order to treat them. We have a special program because we believe that they have to build their own infrastructure. And when I say they, I mean the Palestinians in Gaza and in the West Bank. And we have special program in which we are training Palestinian doctors in our hospital out of our donations. Some donors took it upon themselves to help them to build their own infrastructure by coming to Hadassah, spending between 1 and 6 years in our hospital. And then they go back, and we continue to collaborate with them. So they know exactly what we have. They know exactly what we can offer. And they try to build their own system. But unfortunately, because of the politician, because of the extremers, they can't do it. The average Palestinian citizens would love to be treated in Israel, in all hospitals, especially in Hadassah.
I don't blame them, but my question is, cumulatively, do these individuals who experience what Israel is really about, does it help? Are they getting it? Are they understanding what Israel is all about? And is it promoting peace in some way?
You know, we believe in our mission statement there is a line that we would like to be a bridge to peace. But I'm not naive. I mean, it helps. They come, they experience our attitude. They are very thankful when they go home, but they are not allowed to talk in public about their experience.
Unfortunately.
That's life.
Before we conclude, sir, I'd like to ask you to tell our audience what are the challenges for the future? What are your plans for the future of the Hadassah Hospital?
What we have today in order to be ready for the future is really to complete the Sarah Wetzman Davidson Tower. This is the infrastructure for the future. So we are not waiting for the future. We are building it.
Sir, it's been a real pleasure. I salute you for all the wonderful work you're doing for Israel. Thank you very much, sir. Appreciate having you here.
Thank you. Thank you for your questions.